Okay, I am Mary Ann Perez. I am a state representative for House District 144. This was my freshman year, and whoa, what a surprise. Okay. So it was an interesting session to be there for your first session. So since the passage of the Affordable Care Act in 2010, unfortunately, Texas has stubbornly foregone the opportunity to proactively participate in improving the health care system for millions of Texans. We've refused to create a consumer-oriented exchange where Texans can shop for competitive insurance plans, rejected the chance to provide a coverage option for the working poor, and left billions of federal dollars on the table, tax dollars that Texans have sent to Washington that won't be coming back to help our citizens. Thank goodness for the Affordable Care Act. It is benefiting many Texas women, regardless of our state's leadership short-sightedness in securing even more benefits for Texans. In addition to receiving a long list of preventive services without cost-sharing co-pays or deductibles, beginning on January 1st, 2014, insurance policies cannot deny coverage or charge more simply because of one's gender. As women, we always tend to put our families ahead of ourselves. If it comes between ourselves or our children getting that preventative care, guess what we're going to choose? We're going to choose our children or our families, and probably because women are as strong as they are, we put ourselves last. As an insurance agent, because I'm also an insurance agent, and as Congresswoman Lee stated, it is more expensive for women to get insurance, medical insurance, than it is men, simply because we have uteruses. And I keep thinking, are you kidding me? But it really is true. So, again, thank goodness for that Affordable Care Act. The Affordable Care Act is welcome news here in Texas, where the 2011 legislature cut family planning dollars by 2/3, which resulted in about 147,000 women losing access to preventative care. State agencies have projected an additional 23,000 Medicaid births would occur, costing the Texas state taxpayers $103 million. Fortunately, the recent legislative session appropriated funds to replace the 2011 cuts, not to bring them up to today, but at least we restored up to 2011. However, the damage has already been done, with close to 60 clinics across the state having to close their doors, and with the ideology-driven decision to prohibit Planned Parenthood from participating, poor, uninsured, and underinsured Texas women lost access to a very cost-effective and efficient delivery program. I am sure everyone here remembers the Wendy Davis filibuster. Yes. With the passage of that abortion bill, many clinics are due to close. The sad part is that these clinics did not just perform abortions, but provided many preventative services to both men and women. So now the Affordable Care Act is more important than ever. Even with an infusion of the restored dollars, the statewide safety net system of family planning services was decimated, and it will take years to rebuild it. We will continue in the legislature, a lot of us will continue to advocate for access to health care for all Texas women, and that includes expanding Medicaid coverage through the Affordable Care Act. The highest rate of uninsured in the country, Texas stands to benefit more than any other state by expanding Medicaid. In failing to do so, we will continue to see our emergency rooms flooded with non-emergency cases, higher property taxes due to uncompensated care, and billions of federal tax dollars that have been paid by Texans go to other states. Texas women and Texas family deserve better. So write your governor, call them, write them, email them, the same with your legislators, and let's get Obamacare enacted.